Hello, I'm Chantelle. I'm the dietitian for the Oxford Mitochondrial Team. I joined the team 2.5 years ago now. So I might not have met many of you yet. I haven't made it to a Lily weekend yet. And yeah, I work in the same as Claire. We work in the Children's Hospital. I do a bit of all sorts, a bit of ketogenic diets and metabolics as well. And yeah, I cover both children's and adults in the mitochondrial team. So it's lovely to have you all here today. Okay, so I'm going to talk about diet and nutrition in mitochondrial disorders. I've tried to cover what I can, but it can be quite a broad topic. So I've tried to cover things that I feel like will be most but cover most people. Um, so try and click next here. So in terms of why we talk about nutrition for mitochondrial disorders, so nutrition is really important in helping to manage your condition, and that's because mitochondria are the powerhouse of our cells. So again, going right back to old school biology days, those mitochondria are key in allowing the body to use food for energy. So when we have some mitochondria that aren't functioning as well, or we have less mitochondria that are functioning, it's really important that we are giving those functioning mitochondria enough energy to help you with your daily living. A well-balanced diet and a regular intake can help manage your symptoms. So things like fatigue and muscle weakness and constipation. It might not necessarily resolve them completely, but it can having a good diet can definitely help with managing some of these symptoms. And lastly, maintaining a healthy weight can aid with recovery from illness. So anything from your common colds in winter to if you're having to have surgery. There's a lot of research and evidence that supports, maintaining a healthy weight can help us to recover quicker and supports having a healthy immune system. So some of you may have seen this before. So this is the Eat Well guide. So for most of the population, this is what we recommend. So a healthy, balanced diet. And for a lot of our mitochondrial patients, the same still applies. We would recommend a healthy, balanced diet, but with a few adaptations. So making sure that we're getting plenty of fruits and vegetables in, and choosing whole grain sources of carbohydrates, which I'll go into more in a little bit. And then making sure that we're not having too many, not in all cases, for some people, they might need more high calorie foods, such as chocolates and cakes and things. But for the majority of people who are maintaining a healthy weight, we recommend a healthy, balanced diet with a few adaptations. So our generic sort of dietary recommendations for mitochondrial conditions is to have a regular intake. So that would be 6 small meals. That works best for some people. As Claire says about reflux, that's quite a common symptom that we see. So not only is splitting your meals into smaller portions can also help with reflux. For some people, they prefer to still have their 3 larger meals and then have 3 snacks alongside that. And that's to make sure that we're giving our mitochondria energy regularly throughout the day. The longer we leave gaps between our meals, our glucose, our blood sugar will drop. And then that's when we get those symptoms like muscle weakness and fatigue. And when you then have a big meal again, that causes your blood sugar to go up quickly. And then that's when that can also make you feel quite sluggish, lethargic, and can bring on symptoms like reflux. So definitely a regular intake, and it might be something a bit more than what you're used to. I think most of us probably stick to about 3 meals a day with a snack here and there, but it can make a big difference in terms of fatigue. We recommend that all meals and snacks contain complex carbohydrates and protein, which I'll give some examples over the next few slides. And that's to help with, again, those, like I said, those blood sugars, keeping those nice and level throughout the day, to help manage symptoms. It's also suggested because, like I said, as much as dietary recommendations can help with symptoms, they might not necessarily resolve them. So on those days when you're having really low energy or having, a bad day in terms of symptoms, it's good to have convenient options to hand. So whether that is snacks that you've pre-made and kept in the freezer, or freezer meals. Some people say that they have, like a day a week that they will prep meals, or, just a day that they have a lot more energy. They will utilize that to prep meals that they can keep in the freezer. But equally, things like cereal bars and breakfast bars can be really helpful for some people to keep, their bedside table, if you're struggling in the morning to get going. And this is something that we're probably all not so great at, is staying hydrated. So this can really help with fatigue and constipation. So it's different for everybody, but the general recommendation is about 2 to 2.5 litres of fluids per day. So that doesn't just have to be water, it can be tea, it can be coffee. If you're somebody who really struggles to get those fluids in, then you can opt for more like watery fruits and vegetables. So things like cucumbers, tomatoes, watermelon, berries, they're all quite watery fruits and vegetables. So those all count towards your fluid intake as well. And obviously not this time of year, but in the summer, making sure that you're taking on extra fluids to account for sort of fluid loss through sweating and due to the heat. And we recommend, drinking regularly throughout the day to make sure that you're staying hydrated all day. For some people, nutritional supplement drinks might be necessary to support adequate energy intake. It's quite common. A lot of the patients that we see take nutritional supplement drinks. Some people have them for, like I said, those low energy days, or a day perhaps that you are more active, or you're in work and you need something that's a bit more convenient to keep your energy levels topped up. And that's something that you can chat about with your team or your GP, if you feel like that's something that would benefit you. So in terms of, I mentioned about when we're creating a meal or a snack, to make sure we're pairing carbohydrates with protein. And that's to do with how the food is digested and absorbed. So when we pair complex carbohydrates and protein together, they're digested slower, and that supplies a slower release of glucose into the bloodstream. So that means that if we're having snacks or meals regularly throughout the day with complex carbohydrates and protein, then we're keeping our mitochondria nice and topped up throughout the day, which is how that can help with our symptoms. So examples of complex carbs are whole grains, so oats, barley, quinoa, bulgur wheat, buckwheat, brown rice, and then you've got your starchy vegetables, so things like sweet or white potatoes, squash, corn, and peas. There's legumes, so lentils, chickpeas, beans. Fruits are also a really good source of complex carbohydrates. And then opting for whole grain bread, pasta, and tortillas. In terms of protein helps us to keep fuller for longer. So if you're struggling with weight gain, then I always recommend to people to make sure that all of their meals and snacks contain protein, because it helps to keep us fuller throughout the day. But also, if you're just somebody that's looking to maintain your weight and having a healthy, balanced diet, protein supports muscle growth and maintenance. As we get older, we lose more muscle, so protein can be really helpful to support maintaining healthy muscle. So examples of protein sources are meat, so lean sources of chicken or turkey, which is things like chicken breast, or beef, and opting for, if you're going to the supermarket and getting mince, choosing the lower fat options unless you are somebody that is trying to gain weight. Fish is also a really good source of protein. If you're vegetarian, things like eggs, Greek yogurt, cottage cheese, milk, and then again your lentils, chickpeas, and beans, and also soy products are really good sources of protein. Nuts and seeds are really good sources of protein as well. They are higher in calories, so they might not be suitable for everybody if you're not trying to gain weight, but they are also a really good source of healthy fats and protein as well. In terms of vitamins, I think this is a question that I get quite a lot. As soon as you Google dietary advice and mitochondrial disease, a whole host of things will come up about vitamins. I think it's quite common in the US, that's something called like a mito cocktail. So there's no strong evidence to recommend certain vitamins or supplements to patients with mitochondrial disorders. Some of you may be on or have heard of ubiquinone or CoQ10, and that is recommended for some patients. Again, it's sort of, there's some evidence, but it's not strong enough that we can make it a firm recommendation. And generally people do a bit of a trial to see if it helps and come off of it. And that's how we see whether it's beneficial for them or not. And for otherwise, in terms of vitamins, it's the same for the rest of the general population. So for children aged 6 months to 5 years, they're advised to take a general multivitamin containing vitamin A, C, and D. And then at this time of year, for the whole population, we're advised to take 10 milligrams of vitamin D September to March. And that's just because we get no sunlight this time of year, sadly, unless you're somebody who's living in Barbados every winter, then we recommend vitamin D. There are some food sources of vitamin D, but it's just not enough to get in the same amount as what we get from sunlight. There's no harm in taking a general multivitamin if you want to, but there's just no evidence to say necessarily that it's can improve symptoms in mitochondrial disorders. Struggling with weight gain or struggling to maintain weight is something that we see quite commonly in our clinic, and that is often it's quite hard to get in the energy requirements for mitochondrial conditions. So if this is something that you feel that would apply to you, then generally, first off, we recommend what we call food fortification. So that's taking a meal that you've already got and adding things to it without adding volume. A lot of our patients will say that they struggle with volume or struggle with appetite. So this can be a good way of getting some extra calories in without adding any extra volume to your meals. So things such as cream, cheese, butter, nut butters, milk powders, mayonnaise, they're all really good sources of extra calories. Things like jam and honey are also okay, but I have put on there that if you're diabetic, those are things that we wouldn't recommend, as they will raise your blood sugars quite quickly. But if you're not diabetic, then it's fine to add jam or honey or Nutella to toast and things like that. And then you've also got your more energy dense foods such as nuts and seeds, full fat Greek yogurt and avocado. Dried fruit is also a really good option, but again isn't suitable for those who are diabetic. You can also create more fortified milk, so and then use this in your breakfast cereals or soup, or just have to drink throughout the day. Some people just keep a jug of it in their fridge, and that's just made by mixing 60 grams of milk powder with 1 pint of whole milk. And then, like I said earlier, if you're still struggling, then it's worth speaking with your team or your GP about nutritional supplement drinks. Like I said, some people have them every day and some people just have them as and when they're needed, if they're a bit poorly or if they're having a low energy day. So it's definitely worth speaking with your team if you feel like that would apply to you. In terms of supporting digestion and constipation, this is also something we see quite a lot. And it's really common in mitochondrial disorders to have digestion difficulties and constipation. And this is due to, like I said, some of those mitochondria not functioning, and that affects the movement and stool movement of food and stool through the gut. So essentially, the gut becomes a bit sluggish, a bit slow. And the gut is a muscle, so it will struggle to move that food and stool through the gut. And symptoms can be supported through dietary changes. But as we always say, if your symptoms worsen or if they continue to persist, if you're really struggling with constipation, it's recommended to speak with your GP or your mitochondrial team if you're seeing them first. Because sometimes, laxatives or medication, as Claire discussed, some of the PPIs earlier, might be needed. Even if we make all of these changes, sometimes medication is still needed to help to keep things regular. And that's really common as well. So some tips to support digestion and constipation is a bit sort of similar to some of the tips that I've already gone through in terms of our generic advice. So eating small and frequent meals. It's just giving your gut spacing, having those meals rather than one large meal in one go. It's less for your gut to digest. So that can help you to go more regularly. Increasing fiber, so having more oats and fruits, vegetables, whole grains, having more fiber can help us to go more regularly as well. As I'd already mentioned, drinking plenty of water or fluids throughout the day can help as well. Things like physical activity, I appreciate that's not easy for everybody, but if you're somebody that is able to do even if you're not as mobile, doing a bit of stretching. Since COVID, there is stacks of things on YouTube nowadays that are free. So even something as simple as stretches that you can do sat down or in a chair, or if you are able to walk, there's a lot of evidence that suggests like a 10-minute walk after a meal can help with digestion. And there is a small amount of evidence to suggest that probiotics can be beneficial, but not for everybody. It's something that if you feel like you've tried everything, then you can try probiotics. Obviously, again, they're sort of one of those things that aren't very affordable sometimes, so not for everybody. And it's might be worth trying if you feel like it's something that you can do. So I appreciate I've gone through a lot of options in terms of dietary changes, and we often have this in clinic. It feels like a lot of information in one go. So definitely, if you're sort of feeling like that you would like to make changes to your diet, don't feel like that you have to make all of these changes in one go. So recommend making one small change at a time. So for example, if you're looking at your breakfast and you're thinking, I don't have a protein source in there at the minute, starting with a small change like that by adding in a protein source. So whether that be adding in some yogurt or some eggs. Think about what you can add to your diet rather than take away. I know, especially with the new year coming up, there's all sorts of things online about cut this out of your diet and don't do this. But I think it's more important to think about what you can add, and then naturally that will sort of change your diet over time because you're adding in things that are better, and that will change your diet overall. Some of our patients that we see in clinic find reminder apps or alarms for like hydration and snacks really helpful. There's a few different ones out there, probably more than I'm aware of, but some people find that really helps them. And it's also worth chatting to your workplace, college, university, regarding having food and fluid breaks. I know it's really tricky and it can be quite a difficult conversation to have sometimes, but making them aware of why it's important that you have time to have snacks and fluid throughout the day, especially if you've got quite a busy job, to make sure that you're getting plenty of energy in throughout the day. So that is everything for me. Thank you for listening.